What about Mississippi's health? I think you know, this is our health statistics for many, many years, and it's a flat line. We're either 49th or 50th, and that's a real problem. But there are other problems that are associated with that make it even more dire, and that is if you look at the percentage of Mississippians who now have diabetes, well over 30%, and who are obese, about 75% of our people are overweight and obese, and you do the projections for those, they're pretty startling. But the bigger projection is the one on the bottom there. That is the disability rate in the state. And that is an old number. It's now much higher, but it's not been released. And when you have a quarter or a third of your population that is disabled, you can't make your budget work for the state. So this is not only a personal issue of health, but it is a future issue of the viability of the state. So a group of us at UMC who were struggling with these issues after being there for a number of years and seeing no needles move on anything, asked what could we do? In order to do anything in medicine, especially in Mississippi, you really have to look at the social determinants of health, because that's where the rubber meets the road. And of the 7 major social determinants of health, we looked at what educators and clinicians could do, and we picked out 4 of them. Now, before we could get started on some kind of document to try to get some grant funding to do this, because it's all done on nights and weekends and we have to hire some help, this happened. And this was another hit to our health system, because basically all health care from the coast to Jackson, and including Jackson, shut down after Katrina, from short periods here in Jackson, about a week to 10 days. Fortunately, the university and several of our hospitals had generators and fuel, but the coast, the doctors left, and they never came back. So we were faced with a situation where we had a significant percentage of our population with no health care. So one of the things that the university came up with was an idea with public broadcasting was to put someone on the radio who could answer everyday health questions. And we ended up developing 2 of those people, and it was such a success and so highly utilized that we put that into our working plan that we were developing for trying to address some of the issues that I showed you earlier on. So we called this Southern Remedy radio programming to have a catchy name, and our target audience was anyone with low health literacy. And one of the biggest problems we've had is that we are missing our target audience using public broadcasting. And that was an issue from the very beginning. The people who were calling in were the people who had just gotten back from the Mayo Clinic for their 3rd consultation for hair loss, and that just didn't compute to where we wanted to go. So we decided we were going to expand the radio show, but we're going to try to make it more focused and hopefully get it to podcasts and other social media where it would be more widely available. And that we also should move to television, but most importantly, we should get troops on the ground. That's where the action was, troops on the ground. So in 2016, we expanded our radio programming to 5 hours of live radio doctor talk shows a week. And doctors like me get hoarse about every other week because we catch something from our patients. So that also helped us to substitute for each other. So that was a real backup. But perhaps more importantly was the troops on the ground aspect. And this is one of the lesser known efforts of Southern Remedy, but perhaps the most important one. And that is that we train lay individuals and certify them to take blood pressure, measure blood glucose, measure BMI, and do some basic dietary counseling on site in churches and civic organizations. And because we were very fortunate, and the medical school was very unfortunate in not having any nutrition in our curriculum in the medical school, we were able to embed this into the curriculum of the medical school and the nursing school, and now most of the other schools are coming on board, and teach this Southern Remedy healthy living curriculum, which was developed with a number of folks from our various disciplines who have expertise in this area. And now we are training in every one of our medical students and every one of our nursing students, most of our PT students, and the dental students and so forth in the first year when they're anxious to get their hands on patients but don't have the skills to do it. We're giving them a skill set that they can go into communities and help with screening, because 50% of diabetes and about 50% of hypertension in Mississippi is undetected. And by the time we get the patients, we have end-stage disease, and that's why dialysis units in Mississippi are growing faster than dollar stores. They're literally everywhere, and they're just getting started. And one of the reasons we were able to do this is the Federally Qualified Health Center movement, which started in Mississippi, came out of Freedom Summer, and has been perpetuated here. And we have more of these community health centers in rural areas in our state per capita than any other state, and we also have them in urban areas, and they charge people on a sliding scale. So really, there's nobody in Mississippi that doesn't have access to health care. They just don't know they have it. So we have as incorporated connecting our individuals to those community health centers, which by the way, the present administration has not funded as of this hour, and the funding for which will go zero by the first of the week if it doesn't get funded. But we're hopeful that that will occur. So we can offer people health care even if they have no resources. We've now done a number of health documentaries, and the real value in these, we think, is not the television run times that we get, but they are all put on our website, put into blog sites, put into social media. And you may know that our chicken nugget one actually has broken national records for replay. So, that's where people's interest is, and we'll go there. We have now trained 1,500 community health advocates and are tooling up to train a lot more. If you're interested, we want to work with you. Give me a call. We can send you a medical student to set up a screening, work with your people to train folks, whatever you need, that's what we want to do. And we also have picked up a couple of trophies for these documentaries along the way. So what are the challenges? The biggest challenge in any community service activity like this is communication. Communication between those who serve and those who need the service. And we've been very fortunate that the university has supported us and other similar efforts with a website called GiveGab that allows us to communicate back and forth with groups and with those who serve and accumulate how many hours of service they get, because they get that as academic credit. So that's a nice stimulant for the learners, and we can also provide that to churches and other groups who want to use those. We have a lot of problem with continuing education of those folks we train that we haven't broken through, and turnover. But like all community efforts, since we've decided to go off of funding from agencies where we end up spending all of our time writing grants, it's finances. Fortunately, Mississippi Public Broadcasting and the university have continued to support us, and we're very grateful for that, and we hope that you'll get involved. Thank you.